Hi everybody, so this is our Q&A Friday and we've had a lot of great questions, so I'm going to try to speed through them as much as I can. I took a lot of notes to make sure I don't forget to mention any of them. So first question comes from Beverly Astley. Hi Beverly. She asks, the probiotics I take are working wonders on my stomach, but my immune system is still out to kill me. On a positive, my kidneys are doing better, but my lungs and heart are getting my immune system attention now. Help, what can I do? So this is a good question. So much of our immune system really does reside in our gut. And that's why the probiotics are helping a ton, but it'll kind of have that threshold to as to how much that can help. So the underlying inflammation is what's making your heart and your lungs to get the attention from your immune system. So typically for such inflammations, rheumatologists have these biologics and NSAIDs that they prescribe to kind of tone down the inflammation. But oftentimes that's a problem because they'll terminate that pathway and it's irreversible. But sometimes if you can use the adaptogens and supplements to mitigate such inflammatory processes, you're much better off. And that's sort of what I'm all about, right? So to try to tone down the inflammation without doing too much irreversible damage, because it's all about balance. And so you want to tone down the inflammation, but then you don't want things to go to the other parts of your organs, right? So having said that, we now know that corticosteroids and biologics like Remicade or methotrexate or NSAIDs have only a temporary relief, and they're finding that statistically 50% of lupus patients or any autoimmune patients don't continue because they don't really help after a while or even initially, or they can't handle the side effects. So one thing to mention is that such meds are such a multi-billion-dollar industry. The biologics that's produced and manufactured for especially rheumatoid arthritis, it's huge, billion-dollar industry. And so I think there is an underlying motive to keep patients like us on such medications. And when we talk about the adaptogens and nutraceuticals that I talk about, there's not a whole lot of money in that in research and prescriptions and so forth. So you're not going to get a lot of mention. But I can assure you, I've done the research and I study alongside the Institute of Functional Medicine, where I've been able to expose a lot of good evidence-based research to state that a lot of the immunomodulators do exist in the nutraceuticals and the adaptogens, such as herbals, right? So this can help you a ton. I do want to make a correction though. Your immune system really is not out to get you because that inflammatory response is a healthy one. It's just a little confused and it needs your help to kind of balance and create that homeostasis. The faster you can achieve it, the better you can modulate it so that you can prevent it from going to other organs, right? And so if you remember my post about the mitochondrial dysfunction being at the root cause of all autoimmune conditions or all diseases, even cancer, there is a lot of truth to that particular blog. So please refer to that blog for your reference. But I want to say that our body has a way of receiving signals and metabolizing sort of these chemicals that gets introduced in our bodies. And it's really in our interest to really create a very good, the receptor sites on our cells. So it's all about mitochondrial regeneration. That's where the money is for us. And so how do we do that, right? So you have to remember the receptor sites on the cell is the phospholipid bilayer, which means it's a lot of fatty acids on the outer side. And that's why fish oil good quality fish oil, EPA, DHA, in a proper balance, in a therapeutic dosage, does wonders for us. So if you're popping a pill like a omega or fish oil from just over-the-counter things that you do, the research has found that they contain a lot more oxidized fatty acids, which is not what you want because it's going to really perpetuate the inflammatory cycle. And you want to take it in a therapeutic dose. I give my patients about 2 grams to 3 grams per day, especially if you have an active flare, because that does inhibit the pathways, the inflammatory pathways, without doing irreversible terminations for the inflammatory pathways, which our body really needs. And it's all about that balance. And it's the wonder drug. Like, I really am surprised it's not patented, although they can't patent the nutraceuticals, is why you're seeing a lot more research being done on these biologics and medications that are so toxic. So metabolism is so much more than your body's ability to burn calories. It's our body's way of absorbing information from the toxins and the foods, right? But for us lupus patients, the way we absorb toxins, our tolerance has hit the limit. And so we're a lot less tolerant because of, again, the gut permeability and then the genetic predisposition and then such perpetuating factors like the foods that we constantly take in. So how can you improve the overall health of this? Well, eat a diet full of raw, low glycemic fruits and vegetables. Think highly pigmented fruits and vegetables like dark green leafies, very, very blue organic blueberries, red tomatoes or bell pepper, although they can cause a little bit of an inflammation. And so that's something to consider when you're on an elimination diet. But generally, those things are kind of safe. Think rainbows when you're thinking about foods. And fruits and vegetables are best eaten raw, as we're finding, to kind of break that down, or make juice out of them is another alternative. And then also they provide a way for us to really colonize and these fruits and vegetables in the fiber, the inulin fibers in them really work to keep our probiotics happy. They're the food for our probiotics. So the prebiotics are as essential as the probiotics. I would also recommend CoQ10, and then again, as I mentioned, therapeutic dose of fish oil, and then of course the probiotics, a good quality strain probiotics. I have access to all these things. This is one of the reasons why I have my own lupuspharmacy.com, because I don't want you guys getting toxic stuff in your system, and there's so much out there that can pose a threat for us. Sleep, exercise, and managing your stress are 3 important things in our lives. And then shifting our autonomic state, right? Of going from the fight or flight, like heavily anxious state, to more of the calm and peace state is done very well through the practice of meditation. So I hope that helps. Thank you so much for such a wonderful question. I'm going to move on to the second one. After 30-some years of living with lupus for 4 years ago, I was one of the lucky 5% to be diagnosed with, I hate saying this, it's French, Jaccoud Arthroplasty. It has attacked my hands, feet, and knees thus far. I'm unable to cut down my food at times. I can't open anything, can't hold a pen or write anymore. The strength is gone, and my thumbs are permanently dislocated. All my toes are curling so bad they had to cut the tendons underneath each of them so they would straighten out to avoid ulcerations. Ouch. This has literally crippled me, yet when one researches lupus and its effects, they will state that unlike RA, lupus does not cause hand deformity, which is outright wrong. I have the swan fingers, my pinkies curl when other fingers lay straight and won't bend. It's my belief that ours as a massage therapist made me more susceptible to this condition. I know I have been told there is no treatment for laxity. However, I wondered what your thoughts were as far as maybe supplementation that can possibly strengthen or tighten the tendons. I can bet that... I'm sorry, I hit something here. I can bet that a great percentage of the people that will see this question won't even be familiar with this condition. You'll probably be right. And I will leave this explanation to you, for me to explain to you. Thank you so much, Pamela. You asked such a wonderful question. And thank you for sharing those pictures. They're just, they look very painful. So this particular arthroscopy was first described by Dr. Jaccoud in, I think it was 1869. And it was associated with scleroderma, vasculitis, Sjogren's syndrome, psoriatic arthritis, but mainly SLE. It's also been also seen in non-rheumatic conditions such as HIV, inflammatory bowel disease, and sarcoidosis. As you can kind of understand, all these conditions at the root is all inflammatory. So I want you to really keen in on that, right? The deformity, as shared by Pam, resembles RA, but good news is that the condition, this particular condition, is reversible. The joint deformity is due to the subluxation of the distal phalangeal joints. Subluxation is just a smart term for hypermobility and unstable joints, right? The joints sort of like kind of become like rubber. They don't stay in its place. And it causes swan neck or Z-like deformities in the thumb. Although it's more commonly observed in the fingers, it can also involve the knees, it can involve the shoulders and your feet. There's a presence of synovitis, which is the inflammation in the joint space, and fibrosis around the joint. So synovitis, fibrosis are all at the root inflammation. So I know that this is getting really old, but the root of it is the inflammation. So let me explain. Even though it's hard to kind of consider the joint deformity and such a deformity to be affected by the systemic inflammation, it really is true. If you really understand the workings of our ligaments and our muscle tissue and how they attach to our respective bones to really modulate this activity, it really has to filter through. It involves a lot of central nervous system. It involves a lot of nerve pathways. It involves a lot of muscle activation. This is all at the root mitochondrial deficiency or dysfunction, right? And so the subluxation, it just means that the brain nerve pathway to those fingers are a little bit compromised, not a little bit, but a lot compromised. So having said that, I always want to come back to the fact that certain diseases, and I'll say this probably later on, every disease is a disease, right? I don't want you guys to get bent up on defining or naming a disease so much as understanding at the root, it's the inflammation. All the autoimmune conditions like scleroderma, multiple connective tissue disorders to lupus and rheumatoid arthritis, we have overlapping conditions or symptoms that overlap, so much so that a lot of the times we don't really know what the root cause is. And doctors are so busy trying all kinds of biologics that toxify rather than really heal the root cause. So having said that, as far as the diet, Pam, you can probably go on a very phytonutrient rich. Phytonutrients are those wonder phytonutrients that really sequester the oxidative damage that we get subject to from the inflammation. And you can do that by eating a lot of fruits and vegetables. Again, not so much fruits because of the fructose content, because insulin is probably the most inflammatory hormone in our body. And so you don't want to trigger that peak in our body so much, but so low glycemic for that reason is really good. The fruits and vegetables, like it should be highly pigmented to very deep colors, think rainbows, right? And then eating it raw or barely steaming is the best option. So you don't eat away at the enzymes that it contains, but you're eating the natural chlorophylls, right? You're eating real live healthy foods that's alkalizing to the body. That's always one to remember. And then also limit your protein intake as well, because if you really think about the metabolic pathways, protein and carb high diets can be inflammatory in our body. So when we're looking to heal something like this, you want this to go away right away, right? Immediately. And so if you really want to have a good healing effect, I would go high up on the MCT oils, medium chain triglycerides, and if you want the source, I will gladly give that to you. And then have a diet high in good quality fats like macadamia nuts and pecans. Eating a lot of avocados are good. They're very dense in calories, but also very good for our body as far as the metabolic pathways that heal our body through really utilizing the fatty acids, our fuel source. It really does a number on the healing abilities to our body. The basics of that biochemical action is a little bit far-fetched for this series, but later on I'll go a little bit deeper into that. And then also supplementing yourself with the fatty acids, good quality omega-3 or EPA, DHA in good ratio balance in a therapeutic dose. Like I said, for you, probably 3 grams a day, good quality probiotics. And again, CoQ10 to help the metabolic pathways. And like I said, start there, and then maybe taking a multivitamin supplementation would be a good thing. Methylated forms of B vitamins is another good thing, just to make sure that we're covering all the bases so that your body can be a lot more efficient while toning down the inflammation, really allowing your body to heal. And I know I keep saying this, but there's a good reason why that this is going to be so helpful. So I hope that helps, Pam. There's another question later on that I'll answer, so I'm going to move on. Number 3 is it possible to have negative blood tests for antibodies and still have lupus? I've been positive in every single one and constant worsening of pain and ailments in my body for the past 12 years. But when I was pregnant with my last son over a year ago, I was told about 5 minutes after they drew my blood and I didn't have any antibodies and no further testing would happen. They still put me on Lovenox, though. Now my family wants me to test for multiple sclerosis, as 2 of my aunts have it, and some symptoms are similar. And since my son's birth, I've had back, memory, vision issues, and worsened dramatically. I just don't know where to go from here. This answer or this question comes from Heather Thacker. Thank you so much, Heather. Every one of those symptoms that you described to me has everything to do with mitochondrial dysfunction. There again. So you're going to have all these issues. If they become prolonged, coupled with the leaky gut, guess what? You're going to have a mimicry in your gut lining to go against your own cells. And that's where we have to fight. And it becomes a full-fledged autoimmune condition. Remember last week we talked about the autoimmune triad, right? We talked about the genetic susceptibility. We talked about the leaky gut. And then we talked about the lifestyle triggers, right? These things really, really do matter, right? And so talking about that, you do have genetic predisposition because it runs in your family. MS is too an autoimmune condition. So I'm really baffled at why they don't check your antibodies. But again, at the end of the day, if you're not having an active flare, then I wouldn't worry about it. But I would highly recommend that you take this matter into your own hands by really implementing these good quality diets. I have under files, I've shared a lot of content there. For those of you who are just joining my group, there's a lot of content there that you can use immediately. And if you have questions, please feel free to add to the feed on Q&A that gets posted every Monday and get your questions addressed. So it's very evident that lupus created the underlying symptoms long before the actual diagnosis. If you really share and listen to everybody who shared, we all know that something was wrong years before we were finally diagnosed. And it's also important to note that we just tack on a name to all the symptoms, and really there is no such thing as disease. We just have dysfunction. We have imbalances in our core systems in our body, whether it be endocrinological, whether it be GI, immunological, central nervous system. We have an imbalance, and our body's going to have a host of reactions, and they're going to manifest. And it's a way for our body to tell us something's wrong so we can do something about it. Rather than looking to the meds and asking our doctors, it's really up to you to really try to heal your disease, because I honestly feel like they have very limited things to offer us, right? So it's all about prevention. I know that you know enough to know prevention is key, that you don't want to be sick with lupus because it can be really detrimental to our overall health, right? So, really work on healing the leaky gut, decrease inflammation, and reverse the mitochondrial dysfunction by decreasing the toxic load. And again, going back to the elimination diet that we have under files, taking a handful of vitamins and supplements that really helps in your recovery. Again, I have a good supply of them. You don't have to buy them from me. I have them available only because it's the only thing I trust with my patients, as well as for my own health. It's worked wonders for me. And so I want you to kind of weigh that and make your own decisions, right? Thank you so much for that question, Heather. I hope that that's clear. Moving on. Number 4 is, when having lupus, both lupus and rheumatoid arthritis, is it a difference in flare-ups? So generally, autoimmune flare-ups can be fatigue, weakness, and pain. Those 3 things are pretty much common in everybody, whether you have RA, fibromyalgia, or lupus, or any other autoimmune conditions. RA flare-ups usually flare up significantly, really will involve your joints, particularly your joints in your hands. They'll get really swollen and very big, and they'll be really, really painful. And it does irreversible deformed damage to your joints. So when indeed you are experiencing RA flare like that and really severe pains in your joints, I would seek your medical doctor to really, really tone down that inflammation quickly so that you don't do further permanent damage to your joints, right? The difference between lupus, on the other hand, it can involve multiple organs, right? On top of the weakness, pain, and inflammation, it'll involve other joints. So it works a little bit differently in that way because it can quickly attack our lungs, kidneys, and hearts. And many of you in this group have pain in the heart, pain in the lungs, and some of you have proteinuria from kidney involvement, as I did in the past. And when you do have, and lupus can create inflammation in the joints as well, and then in the muscles, just purely from the inflammation itself, right? Going back to the other questions that preceded this one, in saying that such inflammation can have a host of dysfunctions. And so always going back to decreasing inflammation is key, right? So I hope that that was helpful, Cynthia. That question comes from Cynthia Hildreth. Next question is, I have 2 questions. First, what can be done to help my lung function? I'm currently on Albuterol through Nebulizer and Briault inhaler. These help, but not for as long as they should most days. Secondly, what do you recommend to promote healthy eyes? So this question comes from Emily Logan. Hi, Emily. So Albuterol is typically used for asthma. And if you're using the nebulizer and Briault inhaler, your lungs probably are affected due to lupus. It's probably very sensitive. So like anything else, the inflammation is what tends to constrict the air passageway in your bronchioles, right? And the way we breathe our air. And if they get constricted, you're going to have a very difficult time. You're going to have shortness of breath. And so your autoimmunity is probably affecting your lungs to an extent, right? So lots of great research to prove that therapeutic dose of quercetin, okay, and it's a therapeutic dose, and you can get it from me. I can give you the links, and there's a lot of promising research to really to state that quercetin really, really helps you. And then also you can supplement yourself with, of course, the fish oils, good quality fish oils. That'll really help. But boosting your gut health, decreasing the toxic burden, and eating healthy foods, and also, as I mentioned, probiotics, curcumin, CoQ10 is also warranted for your condition. And I would also recommend an essential oil like eucalyptus and peppermint through the diffuser and put it next to your bed at night so that it opens up that air passageway as well. And so it'll have a cumulative healing effect there. And then also you can you know, really breathe with intention, like taking a deep breath in through your lungs, really improving the lung capacity by really helping your rib cage expansion and rib cage contraction. So this is a natural physiological breathing motion that can really help to not only open up our bronchioles, but really help to improve our lung capacity. So this is a simple way to do that. A lot of my yoga sequences incorporate that, as well as just meditation also helps as well. As for the eyes, eating a healthy diet is key in helping your eye health, right? So pound for pound, your eyes are the most metabolically active organ in our whole body. I mean, because it's so small, but the amount of energy that it takes to kind of do all the things that it does, it really is amazing. So again, phytonutrients and micronutrients, and supplying your eyes with plenty of retinoids, which come from orangey stuff like melon, as well as carrots are good sources. Broccoli, any green leafies are all good options. And okay, so I'm going to move on. I hope that helps. That wraps up that question. Next question comes from Jennifer Greeno. I'm not sure if it's a question. We did find this on the feed, but I'm just going to state it so you don't feel left out. And then when I go on to the next question, we'll kind of sum it up all together because I feel like it's relevant. So this is from Jennifer Greeno. I currently take thyroid medication first thing in the morning. Following that, I have a green juice every morning and take the rest of my supplements. That was just more of a statement, which is great. Second question comes from Pamela again. So it's a very good question and really information-packed question. I'm going to throw another question out there. It's if it's unable to be answered this Friday, you can do away with it. Her question is, for the past 2 years, she's been experiencing several symptoms that fall in line with thyroid condition. Upon testing it, it's been found that I am at times hyperthyroid and other times hypothyroid. Either way, my tests do not come back normal. In fact, my last TSH came back at 0.01. According to lab results slip, the normal range is between 3.5 and 5.5. At other times, this test has come back at 15. My T4 and T3 came back within normal range at this time. I've seen 2 different endocrinologists regarding this problem, and both gave me the same comments. They feel this is a suppression as a result of being on steroids. Well, suppression of what, right? She's been on 40 to 30 milligrams daily. And at that time, her thyroids were fine. Now that she's only on 10 milligrams of prednisone, why these findings? Lastly, even if this is the case, you still have the thyroid issue taking place and symptoms being experienced, so why isn't treatment being offered? They probably don't know what's going on with you. Symptoms that she's experiencing for the last 2 years is hair loss, brittle hair, weak and brittle nails, both weight gain and weight loss, protruding eyes, chronic diarrhea, dry skin, palpitations, a feeling of extreme restlessness, terrible heat intolerance, and the list goes on. I have been tested for Graves' disease as well as myasthenia gravis, both normal. As a side note, I do have 4 nodules on my thyroid and had them biopsied this past June, but they were benign. Thank you. Very good question. So after being on that much corticosteroids for so long, it did probably suppress your adrenals. Your adrenals make the corticosteroids, right, in our body. It's physiologic, but when we replace it with prednisone, which is a powerful NSAID, like it really decreases our steroid production in our body through the adrenals, right? And so you're bypassing your natural physiology for so long that when you taper down to 10 milligram, many of the group members here can't get off of the prednisone because you've lost your own body's ability to produce this hormone. And so you're just sort of in a bind. But rest assured, with proper regimented regimented protocol, you can probably revive your own ability. But it's a multifaceted approach, and you can't do this without the medical guidance. So it would have to mean that you'd have to find somebody who is functional medicine minded. So this is really where the functional medicine approach to treatment versus conventional approach to treatment is very, very different, right? So our hormone pathway is called the stereogenic pathway. We study this like to the detail in the functional medicine program because of all three things, right? It's not just your gonadal hormones. It's not just your sexual hormones. It's not just your thyroid. It's not just your adrenals. It's everything is kind of interconnected. Everything starts with the cholesterol that our body makes, and then it goes into our adrenals, and all the pathways are sort of codependent on one another. And so having said that, your balance within the homeostasis in your system is so far off kilter. Your body's probably having a difficult time. So my question would be, regarding the thyroid specifically, I wonder if anyone's checked your selenium or iodine levels, or even the antibody levels for immunoglobulins or antibodies towards your thyroid. So to kind of rule out the Hashimoto, because some of the symptoms that you exemplify, it can go either way. It can be hyperthyroidism or hypo, but you don't necessarily want to blame the thyroid so much as all the other stereogenic pathways. This all goes back to the metabolic processes in our body at the cellular level. Are your cellular receptors healthy enough to kind of modulate this effect, right? So you really have to pull back and understand the system's biology to ask the right questions from the elementals, from the, because there's two ways to look at medicine, right? There's the upstream way where this affects everything downstream, or you look at the downstream medicine and don't worry about the upstream, but you have to have a keen idea of both, because obviously you're having multifaceted issues. So I would highly recommend, again, going back to your first question, Pamela, really supplement yourself with good amount of fatty acids, supplement with the CoQ10, get yourself on an elimination diet, and really get yourself on a really strict regimen to kind of rule out stuff, to make sure that you don't keep putting yourself at risk with so much toxic overload, right? Your body just isn't handling the metabolic pathways very well, right? So it's a very dangerous situation to be in. But in the meantime, I would go back to your doctor and see if, again, the thyroid antibodies can be checked, and then reverse T3, and then, of course, T3, T4, and TSH. Like, I really would have to look at all of them in conjunction with almost your cortisol activity, right? And so adrenal hormones as well, to kind of really understand what's going on with you. This is not conventional medicine. Again, it's functionally minded. So this is another conversation all in itself. So hopefully you can ask this next time, or if you have further questions, you can private message me or ask me next time, and I'll do my best to sort of help you in this way. Next question comes from Darlene Starosi Hayes. I hope I said that right. I hope I didn't bastardize that. Can plaquenil make you hurt more? All right. So it's a very good question. I'm going to end with this. So there's a lot of genetic variations, right? The detox pathways are very complicated. We are finding more and more that most of us walk around with genetic variations, right? Going back to that, we're finding that many of us process different foods differently, like sulfur-rich foods. Some of us are, intolerant to certain things. I'm intolerant to penicillin. Some of my patients, anything sulfur-related drugs, it's a no-no, because of you lack the genetic enzymes that's required to kind of metabolize certain medications. So there's two phases to the metabolic detoxification pathway, is why I'm so big on detox. But you talk to any conventional medical doctor, they'll call me a quack for saying this, but really, they don't really understand the nuances of this. So phase 1 and phase 2. In the phase 1, when we do take in the medications, a lot of the medications require certain enzymes, and that's genetically driven. If you don't have a genetic ability to create that enzyme, you're going to have a difficult time metabolizing that particular medication. If that is you, and if that is the plaquenil for you, you can have headaches and muscle pains and all the host of side effects that plaquenil does. But it's one of the least toxic medications that's well tolerated. In the field of rheumatology, it's supposed to be a health insurance medication for most of rheumatic diseases, right? Including lupus and RA. And it's something that they keep us on to maintain or prevent flares in our bodies, right? And so depending on if you can handle it or not, it will affect you differently. So if it's causing headaches, I would talk to your doctor and see if you can stop it, because it's not worth the side effects if you're not able to metabolically handle that. There are tests that you can do. It's called SNP, single nucleotide polymorphisms, right? These are certain genetic mutations that you have that predispose you from metabolizing certain medications. And there's some testing that we can do, or not take it at all. It's not required. These are some of the more in-depth functional medicine approaches to things, where we go dive deep into your genetic susceptibilities to understand exactly what you can and cannot handle. To me, it's not really necessary. If it's making you feel bad, that's probably why. And so I would talk to your rheumatologist and ask her questions about the alternatives. And again, going back to, if you want to feel better, go back to that elimination diet to start, or generally a healthy diet. I've got a lot of information at lupusrebel.com to share with you. The recipes are up there. Everything's pretty standard, or I say consistently the same thing. Phytonutrient rich, micronutrient rich, nutrient dense diet, high in vegetables, low in carbohydrates, not too much protein. So I'm not full on paleo, I'm not full on keto. I'm all about balance and equilibrium in your body, with supplementation to kind of get through the hump, because nutraceuticals, along with the adaptogens and herbals, huge amount of data to really replace a lot of the biologics that we're taking in our body as rheumatology patients. This is real deal. So I have all that available for you. Keep asking me questions so you can be empowered and well informed about the choices that you can make as you walk your path through this crazy, I guess, imbalance. I'm going to refrain from saying disease. Okay, so I hope this helped. I'll see you and catch up with you next time. Please subscribe. I would really help. I would really appreciate it if you subscribe to my YouTube channel, as well as my lupusrebel.com. Go ahead and subscribe to my newsletter so you can be informed. And lastly, please like me on Facebook on Lupus Rebel page. It really increases our exposure to new people with lupus or any rheumatic or chronic illness patients. And lastly, I've started a podcast and many of you have opted in. I would love some positive reviews. iTunes link is on my website, lupusrebel.com, under podcast up at the menu. And so you can find all that. All the links will be provided on this post on my blog. Everything will be shared on my YouTube podcasts. I'm trying to get as much information out for you guys as much as possible. So I'll see you next time. Thank you.